My name is Conor Owens. I'm the director of the Triple P initiative in the Midlands Area Partnership. We developed this initiative or this programme starting in 2010. A group of us came together with the idea of what could we do to improve the quality of life for children and families in the Midlands, primarily in Longford and Westmeath. So we started with a need that we identified. We then moved on to looking at what kind of outcomes we wanted to address. We formed a partnership because we thought no one organisation would be able to have the reach and the acceptability to deliver a population level programme. Our aim was a population level programme. We wanted to make sure that there was something on offer for all parents in the Longford Westmeath area, not just a specific grouping of parents. So our assumption was that parenting goes well for a lot of people most of the time, but it's no respecter of class or targeter of class. There are difficulties for parents in lots of different groups at lots of different times. So with the partnership, we decided our outcomes that we wanted were to improve quality of life for parents with children under the age of 7. We picked that key transition time, the movement into national school. We then went and looked at the literature to find out what actually would address those needs and give us the outcomes that we wanted. That wasn't a difficult task because there was only one programme that we came across that was evidence-based for parents and had a population focus, and that was the Triple P parenting programme. And that's why we went with that programme. The selection of the programme that we picked, the Triple P programme, was quite quick, again, because there wasn't much choice out there. There weren't many other programmes. However, the evaluation process, we went through our initial plans ourselves within the partnership and the team, and then we worked with NUIG, and that further developed the evaluation plans. But I would have to say one of the things we learned was that, unfortunately, when you develop an evaluation plan, there isn't an end point. You have to keep continuing looking at outcomes and following outcomes. So it's not a clean break, it's a continuous quality improvement process. The partnership, naturally enough, set about trying to figure out how are we going to achieve this population impact. We had a programme. The actual use of the programme is a completely different story. What we did and what we had support from the HSE and Child and Family Agency to do was to set up a core team. This became extremely important in the rollout of the programme. The core team meant that people who were already existing employees of the services had their jobs reorientated to work either full-time or 3 days a week on the delivery of the Triple P programme. This allowed us to build up confidence and competence within the practitioners very quickly. It also allowed us to address sustainability issues very early on in the process, in that this implementation or core team could develop into an implementation team. Now, I'll have to be straight and say, we knew very little about implementation at the start, so this wasn't part of a grand plan. It just fell together nicely, but having the core team was something that we wanted. We just got more benefits from it than we expected. The core team then worked with local practitioners. They would have been staff from the partner organisations, the voluntary community groups, and they worked on a less frequent basis with us. They gave less hours. There was a commitment to 100 hours per year. And so they had mentoring support from the core team. The partners that we had were all people organisations that had self-selected to be part of this process. They had seen that a universal approach to parenting or parenting as a public health issue was core to their work. They included organisations like Longford Community Development, Longford County Childcare Committee, Westmeath County Childcare Committee, the local VEC, Athlone Community Task Force, HSE, TUSLA, Bernardo's. There were a number of different organisations. There were 9 organisations in total in Longford Westmeath that became part of the partnership. The core team that I mentioned, they were made up primarily of they were made up of health promotion staff and child residential staff. We also got support from public health through research. We got admin support, which is essential, and it was one of the things that we really emphasised a lot at the start, that people are happy to deliver programs, but there's a huge amount of support work required for that. So admin is a real consideration for starting a program like this. There were a number of challenges that we hadn't foreseen. The first one, an obvious one, was recruitment. We expected, because we had an evidence-based program, that was fantastic, and once we told people that, you know, the likelihood of this working is very high, we thought that would be enough. What we soon discovered, that actually there are a number of crucial steps before offering an evidence-based program, and that was, the first one was destigmatizing of the topic, and the second one was normalizing help-seeking behaviour around parenting. When we started, we quite frequently heard parents saying, evidence-based parenting programs, fantastic, should be available for everyone, but for everyone else. So we had to spend a lot of time, and we continue to spend that time in letting parents know, this isn't just for your child where there's significant problems. This is for parents who want to find out whether what they're doing is good, to get some more tips, to find out how they can prevent problems from arising, and for parents who have mild and significant problems in their families. One of the really interesting learnings was that all of these groups of parents could benefit from attending the same course. They didn't need to be split into different groups. Once we decided to work with Triple P, their contact with us was extremely helpful. They started to prompt us in areas that we needed to look at, and preparation that would need to be done for training. There's an awful lot of preparation in terms of organisational readiness that needed to be done. And we actually would do more of that now if we had the opportunity. But once we decided on the training and the types of training that we wanted, we produced or formed a contract with Triple P. They came, they did the training. There was a training process. It lasted 4 days. There was a pre-accreditation and an accreditation phase. So the pre-accreditation was where people came together who had done the training and went back over particular competencies, not just knowledge-based, but skills competencies that they needed to be able to deliver to a specified standard. And then there was an independent accreditation process. So what was really nice was that in the training process, there was a quality control element, in that it wasn't just a train and hope situation, which is the common experience. It was a train, prepare for the accreditation, and go through an accreditation process where you needed to demonstrate that you could deliver an evidence-based program in an evidence-based way. The implementation support processes became extremely important as we became aware of implementation and we started to read the literature. It became really clear that there are a number of evidence-based programs out there, but that doesn't assure you that you're going to get the outcomes that you expect. There are many examples where, when they're not implemented well, you do not get the outcomes that the program is capable of helping to deliver. So we started to put quite an amount of support and time into trying to figure out what will actually work for the practitioners and what will work for them in a way that skills them up, not a way that keeps them being monitored. So there was a large element of self-regulation that was built into our implementation support. The things that we did in the implementation support were, we had practitioners co-deliver so that they would learn from each other. We had then practitioners would swap around so that they would learn, they would broaden their experience and gather their stories around implementation. We also then set up Skype calls with trainers from Triple P, where they would take part and listen to discussions between our practitioners on how they delivered and how they dealt with different issues. So there was a mentoring support there that was brought in. But again, it was very much around the self-regulation. We also, so that built up the competence and confidence. What we also did was we built up the level of responsibility by practitioners taking on responsibility for geographical areas, so that they would learn. All areas have their own ways of operating and they have their own contacts. So instead of having the assumption that one structure will fit all, the idea was bring your skills and knowledge and find out how to fit that with the local structure and local resources that are out there. In terms of outcomes, we had an independent evaluation carried out by NUIG. The outcomes that we found were that not only did the programme work for parents and children, it lasted, but also there was a ripple effect in the community. So parents started to influence other parents. There was a conversation that started between parents who were passing on tips that they had learned in the Triple P programme. That's not a usual thing for people to do, to offer parenting tips to a friend or a family member. That doesn't always go down well. So the fact that they had enough confidence in the skills that they had learned, I think says a lot about their experience of the programs. So really what we found was there were very significant gains made at the individual level for the participants, the parents and the children. These gains lasted. We did a follow-up, 6-month and 12-month follow-up. And in the population, what we found was not only were there population changes, but for children who had high levels of need of social, emotional, behavioural problems that would be in the borderline or clinical range, at the population level, 37% of those dropped out of that range. In our matched comparison area, those scores rose by 8% over the delivery time. In terms of parents, for what they got out of it, there was a decrease of 30% in parents with mild to moderate levels of stress and anxiety at the population level. So these are very significant changes. We've learned to be much more efficient in the way we deliver the programme, and that has been evidenced by our expansion and rollout into Laois Offaly, where we are now delivering to bigger numbers on a quicker basis. So there's been quite a bit learnt about the implementation, and we're now up to about 4,500 training spots per year. We evaluated the implementation as we went along by looking at recruitment rates, retention rates, delivery rates, at ways in which we improved each of those variables. So I suppose one of the key things to the implementation, and it harks back to the idea of this evaluation process evolving, was that when we'd be taking decisions, wherever possible, we would try to collect data on it to see, instead of arbitrarily or on a hunch changing the way we did something, we would try to gather data on it to see, did that actually make a difference? It also makes the running of a team much more transparent when it's not solely down to opinion. You're actually gathering information. Now, you can't do that on all areas, but where it can be done, it actually makes things a lot clearer. We have also moved from delivering in Longford Westmeath. In 2013, we started to deliver in Laois Offaly. So we're delivering in those 4 counties now to parents with children 7 years of age and younger. From March of this year, we will be starting delivering a teen parenting programme, Triple P teen parenting programme, across the 4 counties. We didn't write enough. We had it in our heads, and we had lots of conversations about what we were doing, but it's really important and it saves a lot of time if you write it when you're actually going through it. I think one of the learnings we've had is talk to as many people as possible, because you never know where that information is going to end up. If you look at the media, when they're talking about parenting, they're generally showing really extreme cases, and they're showing quite complex at times, either ways of dealing with it or the need for an expert. What the Triple P pushes is that the programme is for everyone, and it's about small changes, just the ordinary stuff. And if you can do the ordinary stuff, then a lot of the other stuff, not all of it of course, but a lot of the other stuff looks after itself.